To perform a complete or partial bed bath, first assess the patient's skin and other factors.
Oh, I'm all right.
Any areas bothering you, itching? Better. Would you like to use the urinal before we get started?
Then give him a chance to void.
All right, I'm going to get some nice warm water and I'll be right back.
After arranging all the supplies on the overbed table, raise the bed to a comfortable working height, lower the side rail near you, and help the patient into a supine position close to that side of the bed.
Yes.
Okay. Better? Mm-hmm. All right. Now we're going to go ahead and put it, if you'll hold.
Then place a bath blanket over him and ask him to hold the top of it as you remove the top covers.
Leave the nice warm bath blanket on you.
Now remove the patient's gown or pajamas.
Okay.
If he has an IV line, an injury, or reduced mobility in one arm, begin removal from the unaffected side first. Then take off the gown from the other side. Remove the IV tubing from the pump, take the container off the pole, and slide the container and tubing through the arm of the gown.
There we go.
Then rehang the container and adjust the flow rate as needed.
Hook you back up and we'll get ready to bathe you there. All right, I'm going to get your bath.
Raise the side rail and then fill the wash basin 2/3 full with warm water, being sure to check its temperature.
Test it. Let me know if that's a comfortable temperature for you.
Also have the patient test the water temperature to make sure he can tolerate it.
We'll go ahead.
If desired, warm the body lotion in the water. Now lower the side rail and, if allowed, remove the patient's pillow and raise the head of the bed.
Go ahead and relax. Going to raise your head up. Is that comfortable?
Mm-hmm.
Okay.
Place one towel under his head and another over his chest.
Forward again, just to get a towel underneath you there. There you go. How's that?
All right.
Okay.
Then immerse a washcloth in water, wring it out thoroughly, and form it into a mitt as shown.
Mr. Peterson, I'm going to go ahead.
If the patient is not wearing contact lenses, wash his eyes with plain water, bathing from the inner to outer canthus and using a new section of the cloth for each eye. If needed, soak any eyelid crusts for 2 to 3 minutes before removing them. Dry around the eyes gently and thoroughly.
Okay. I'm just going to go.
Next, wash, rinse, and dry the patient's forehead, cheeks, nose, neck, and ears without soap. Or if he prefers, use soap to wash these areas. Ask a male patient if he wants to be shaved.
I'm going to go in your ears. Would you like to be shaved today?
No.
No?
No.
Okay. You go ahead and dry your face then, okay?
For an unconscious patient, use a washcloth to clean the eyelids from the inner to outer canthus with plain warm water. If prescribed, instill eye drops or ointment. And if the patient has no blink reflex, keep the eyes closed and covered with an eye patch or shield.
Okay, let's go ahead and get your arm.
Now remove the bath blanket from the patient's right arm and place a towel under it and the basin under his hand. If you're going to provide nail care, let his hand soak for 3 to 5 minutes and clean under his fingernails as needed.
For me and soak it there. There you go. 'Cause 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 'cause
While the patient's hand soaks, wash and rinse his arm from the fingers to the axilla, using long, firm strokes and minimal soap and water. Then wash and rinse his hand and dry his entire arm and hand.
Okay, go ahead and soak. Just going to rinse your arm. Okay. Going to get your hand next. Okay. All right, I'm going to take your basin. Go ahead and leave it. There you go. There we go.
With the patient's arm raised and gently supported over his head, wash,
You okay to
rinse,
hold
and
your
dry
arm?
his axilla thoroughly.
Do you like deodorant or powder?
Deodorant.
If needed, apply deodorant or powder to his underarm.
All right.
Then at the other side of the bed, lower the side rail, place the towel under the patient's other arm, and clean that arm, hand, and axilla the same way.
Chest next, okay.
After cleaning both arms, cover the patient's chest with a bath towel and fold the bath blanket down to his umbilicus. Then bathe his chest under the towel using long, firm strokes.
Remember, try and rotate your body what you can.
For a female patient, take special care with the skin under the breasts, lifting them up with your hand. Remember to rinse and dry the area well.
Want to see if this water is still
At
warm
this
enough
point,
for you?
check the water temperature and change it if needed. Otherwise, continue by moving the bath towel to cover the patient's chest and abdomen and folding the bath blanket down to just above the pubic region.
Next, okay.
Then bathe the abdomen under the towel, paying close attention to the umbilicus and skin folds.
Go to the legs next.
To wash the lower extremities, cover the patient's chest and abdomen with the top of the bath blanket. Then expose one leg by folding the blanket toward the midline, but keeping the perineum covered. Next, place a towel under his leg, supporting it at the knee and ankle. Now wash the patient's leg using long, firm strokes from the ankle to the knee, and then from the knee to the thigh.
Try and keep your backside around a little bit if you can.
Okay. We'll go ahead and finish rinsing you.
After rinsing the leg, dry it well.
Back. There you go, good.
Okay. Now we'll get your foot.
To continue, wash the foot and clean carefully between the toes. Clean under the toenails if needed. Dry the toes and feet completely, and then discard the towel in the linen bag or hamper. Now move to the opposite side of the bed, lower the side rail, and wash the other leg in the same manner. If the skin is dry, apply moisturizing lotion. After raising the side rail, change the bath water.
There we go. Now get some fresh water. I'll be right back.
Okay.
With fresh bath water at hand, lower the side rail and help the patient into a prone or side-lying position.
Make it easier. Now I'd like you to help me turn your onto your right side there. Keep you warm. Okay. Your arms okay?
Mm-hmm.
All right. Yeah, go ahead and wash your back for you.
Place a towel lengthwise along his side or back. And keep the patient covered by sliding the bath blanket over his shoulders or thighs to expose only the area to be bathed. Working from the neck to the buttocks, wash, rinse, and dry his back using long, firm strokes.
How does that feel?
That feels good.
Yeah.
Then bathe the buttocks and rinse and dry the area.
Okay, gonna rinse you off here and be done in just a minute. Okay.
Apply body lotion or moisturizer as needed.
Feel good?
Mm-hmm.
When you're finished, cover the patient with the bath blanket. If the patient is able, allow him to clean the perineum himself. If not, perform perineal care for him.
Do the washcloth
For
now.
details, see Performing Perineal Care for a male patient or Performing Perineal Care for a female patient.
Okay.
And then we'll let you rinse.
For some patients, a commercial bag bath or cleansing pack may provide a quick cleanup. First, warm the cleansing pack in a microwave according to the package directions. Use a new, individual pre-moistened towel for each area of the body to be cleaned. Allow the patient to wash herself as much as possible to promote independence. Assist as needed. When bathing is completed, apply a clean gown or pajama top, dressing the affected side first.
Okay, we'll get your IV.
As
bottle
needed,
through here, and
assist
then
the
your
patient
arm.
with grooming, oral hygiene, and hair care, and then make his bed.
There you go.
For details, see the appropriate video skills.
Give me just a minute and I'll help you with the other side, okay? pull your bath blanket. Okay, we're all through
As
with
part
that.
of follow-up care,
would you
have the
like
patient rate his
anything
level
else
of
at this
comfort
point?
and ask if he feels fatigue.
Thank you very
Comfortable?
much. That's very nice. Thank
Okay.
you.
How about anything for pain?
No, I don't need anything.
Okay. Would you like a drink before I go?
No.
All right, I'll just pour some and have it there for you, okay?